2, 1.
Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention, which we often forget and end up neglecting our hair. Earlier, thinning hair, bald patchy hair, and hair loss was a problem were noticed in middle age or older people. However, with increasing bad lifestyle choices, poor stress management, and environmental pollution, we are now seeing hair problems even at a younger age. It is not now uncommon to see 25 to 35 years old people complaining of hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today, we have with us Dr. Krupa Modi, who is respected dermatologist based in Mumbai. She currently practices as consultant dermatologist at Dermapurity Khar, Mumbai. She has completed MBBS from Maharashtra University of Health and Sciences in 2016 and MD Dermatology from Dr. D.Y. Patil Medical College in 2021. She has wide variety of expertise like in urticaria, acne, hair loss, botox, vitiligo, and dermatosurgery, laser. Dr. Krupa Modi is cognizant of the patient need for the awareness and education about hair care, and hence spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Krupa Modi, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show. डॉक्टर
Thank you so much. Thank you so much, Mona.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So doctor, today we are going to discuss the role of vitamins and minerals in hair management. So doctor, the first question which come up to the mind is like hair loss, and which is the most common problem seen by all of us, whether younger people or the older people. So doctor, hair loss, what's normal and when to be concerned for?
So, Mona, exactly. Hair issue has been increasing widely in all age group these days. As you rightly said earlier, we used to always notice in elderly people, but nowadays even teens and younger generation also we see hair loss. Hair loss does not have a boundary of age, male, female both see hair loss. Now, when do we define as hair loss? Because normal shedding of hair is a normal phenomenon that happens. Our hair is always divided into three phases, which is called as anagen, which is the active phase, catagen, and telogen. Telogen is the shedding. So normally we see 50 to 100 strands of hair loss, which is absolutely normal, nothing to worry, because our hair which is in telogen phase is going to shed. But anything more than that, or any specific pattern of hair loss, any specific area where we see a bald patch or thinning, is something where we should be concerned about. Or any other family history which triggers us to an early hair fall or early hair issue is something to be taken care of and something which has to be again supervised by a medical professional.
Okay, so doctor, actually, like nowadays, whenever we comb our hair, we see like hairs are coming out. So like sometimes, the mother used to say the children's like, oh my God, what's the hair fall is abnormal. So is there any estimation of hair loss per day or something like that, or it's just like only the Pacific?
50 to 100 hair loss per day is normal.
Okay, 50 to 100 is normal, and if it is more than that, then it's time to visit the doctor.
Yes, it's time to take some steps for it.
Okay. So, doctor, what are the general causes of hair loss?
So, hair loss is many other reasons. Okay? But one of the most common reasons that we see hair loss is androgenetic alopecia, which is commonly said as male or female pattern hair loss because it's different according to the gender. Other causes can be any medical cause, which includes thyroid, any hormonal imbalance, patient is on chemotherapy, or any nutritional deficiency. Because hair is made up of a lot of nutrients, where we say protein is one of the most important nutrients. So, any nutritional deficiency, any stress factor, which all of us take very regularly this day. So, any mental or physical stress. So, any patient which has suffered from an infection or anything, which is a physical stress, which adds up by the mental stress, can also lead to hair, which is also known as telogen effluvium. And hence, that's why post COVID, we saw a lot of hair fall issues. Because during COVID, the infection was taking a toll on your physical body, and the stress of COVID was taking a toll on your mental health, both of which led to a lot of hair. And there
Okay.
was a specific entity that we saw as post COVID hair loss.
Okay, so that means the even if you get any viral infection or any kind of infection can also lead to a hair loss.
Yes.
And yes,
So commonly after malaria, dengue, COVID, any viral infection, post
so
3 months we can see hair fall.
okay, so that such kind of hair fall is like just let it go, or we should visit the doctor after
Of
that.
course, why is it happening? Because if physically your body has gone through something. So your nutritional deficiency becomes increased. And hence it's important to take care of the nutrition at that.
Okay.
Some stress relieving pattern, some nutritional, so some nice vitamins, minerals added in your body, antioxidants. These all will help this stage in improvement a lot.
Yes, and so it's better to visit the doctor and get the proper nutrition
Yes.
so that the hair loss can be avoided. Okay, it's good to know that. So, doctor, right nowadays we all, have a bad lifestyle choices, late working hours, eating late, and getting up late, working late night. So, can a person lifestyle also play a role in hair loss?
Of course. Mona, you answered by in the question itself. Eating late, lifestyle changes, very good, very bad mental stress, work stress, home stress. All of this adds up to your stress level and increases hair loss. Even the food that we eat, because there's a lot of increase in junk food. Your body requires 1 gram of protein intake per kg. So a normal person of 60 kg requires 60 gram of protein, which we usually don't consume in our normal day-to-day routine. That can lead to hair fall. Yeah. The essential few vitamins and minerals are lacking in our diet. So all of this, so poor nutrition, stressful lifestyle, all of that leads to hair. Even few practices that we do can also increase hair. Like we are all used to meetings and all, so we blow dry our hair a lot. We straighten it, we curl it. These heat styling procedures can also damage the hair follicle, and because of that, it can lead to hair. So
Okay.
all this stressful stuff, the lifestyle changes that we have made, smoking is increasing in male and female both. That can all lead to hair loss.
Okay, so is it like smoking? Yes, like all kind of like alcohol also. Like every youngster try to drink a lot of alcohol. Also, weekends are like drinks party. So, like even the alcohol play a role in hair loss, or just like
Alcohol
only
has a
smoking?
direct relation with hair fall, but I will never advise you to take alcohol because it has many other side effects and many other adverse effects.
Okay. So we should take proteins as per our body weight and all the nutrition to avoid the hair loss, and also try to follow a healthy lifestyle to avoid the hair loss problems. So, doctor, the next question is like, what are the medical treatment options for hair loss? Like, is there any topical, surgical, or non-surgical, or is there any oral also? Like, just eat it and get the hair problem solved.
So one of the most important thing is knowing what is causing the hair fall.
Okay.
Okay. If you don't know the cause and you're just treating blindly, you're just shooting an arrow where you don't know when you're going to aim. So there are many treatments available. Like topically, we have minoxidil. we have peptides, we have retinol. These are topical formulations which help in regrowth of hair. Because minoxidil is a vasodilator. So it helps the hair nutrition to reach there better by causing vasodilatation. Now, peptides also help in a similar way. There are oral vitamins, mineral, biotin supplement, iron, zinc. All of this also helps in hair regrowth. But knowing what causes the hair fall is again the utmost important. Few oral preparations like finasteride, dutasteride also helps in androgenetic alopecia. Even hair transplant techniques, like there are follicular unit extractions that are available, which can cause very good hairline reconstruction where there are no follicles available. One of the very good non-surgical procedures that are available is PRP, platelet-rich plasma therapy. Also, the advanced one, which is called as GFC, growth factor concentrate, in which we take the patient's blood, we centrifuge it, and we remove the growth factors from the platelets. So patients' own growth factors will help them regrowth of hair, which is one of the very good modalities where monthly taking PRP shows excellent results. It was earlier done for bone rejuvenation. It can be used for hair, face, everywhere, wherever you need. So monthly PRPs can help you. GFC can help you. Hair transplant can help. So all these are different procedures. Even LED therapy. So red light therapy can also stimulate hair growth. So there are many modalities available. But knowing which modality will work for you, you have to meet a specialist so that a correct diagnosis made and a correct treatment can be suggested. So it's not like hair fall cannot be treated. Hair fall can be treated by many different mechanisms available and many latest technology. But you have to know where you have to go.
Okay, so for treatment purposes, you need to visit the doctor. Just do not take up by your own and do it, and end
Don't
up.
be an Instagram doctor. Yes.
Yeah, don't be an Insta. Yeah, very nice, doctor. It's a right slogan for today's world. Don't be Instagram doctor. So, doctor, like you said, the growth hormone is like your own growth hormone is taken in and to
Growth
avoid
factor.
the growth factor. So, is it like hormone therapy kind of? Is it like no, don't have any kind of side effect? Or it's good to go.
Factors which are derived from the platelets, which we
Okay.
injected back into the hair follicle.
Okay. Okay.
Hmm.
So it's good to go. It's nothing to worry about it. People
Nothing
can.
to worry. It's a very safe therapy. Can be done for a very healthy growth. Also, I personally take PRP for myself also. So it's one of the best therapies available.
Okay, okay, good to know
You
that.
should definitely try it sometime. Yeah.
Yes, definitely, definitely. Our viewers will also, quite interesting because PRP is, is very common, and now people are, thinking to go for it. So, but every time question mark is whether it is a hormonal therapy or it is like a growth factor kind of. Okay. So, moving to our next question, Doctor, nowadays, a word called nutraceuticals is getting a lot of focus, and so what is this nutraceutical and what role does it play in hair health?
So nutraceutical. It's nutrition combined with fats. Okay, so basic nutrition plays a very important role in your daily lifestyle. But sometimes in our daily routine, few of our basic requirements are not met. Because, as for example, vegetarian will not get enough protein and vitamins. So all of this has to be taken by a supplement. A curated good supplement for your dietary requirement is essential. So very good nutraceuticals are available, which has vitamins, mineral, antioxidants, biotin, iron, zinc. All of this gives you a very good nutrition. This taken in a cyclical therapy works wonders. Like I'm a lucky person. I'm a mother of 9-year-old baby girl. And that's what because of the cyclical therapy that I was taking during my pregnancy also, I did not suffer for any postpartum hair loss.
Okay.
So a good nutraceutical can take you a long way because if a patient suffers from hair loss, they have a lot of stress and all are also involved with. So whenever you know that you have gone through a infection or let's say birth. Giving birth is a big responsible thing that we do in our life, which takes a toll on our body. So you have to make sure that you supplement yourself with diet and nutrition, as well as some nutraceuticals can also benefit you quite a lot.
Okay, so the nutraceuticals are important for both men and women, but women's are, go through the hormonal changes throughout their life, so they should go for nutraceuticals. Okay. Doctor, what are some of the vitamins used in the management of alopecia?
So vitamins which are commonly used in biotin, which is vitamin B7, which helps in growth of keratin, which is the basic structure of your hair. Other vitamins that are used is vitamin D. So vitamin D is also very essential for hair loss. Hence, if you're getting a lot of hair loss, you should check your vitamin D levels as well. Few other things are vitamin E, vitamin C. These vitamin E is an antioxidant. Vitamin C increases collagen synthesis. So all of these vitamins also play very important.
Okay. Okay. So, doctor, these vitamins are important for alopecia. So, is it like taking these vitamins for the like whole life, or just takes for some times and then you can stop them because you are at the right phase, or taking them whole life is like not like it's not a problem. You can take it, nothing to worry about it.
So hypervitaminosis is also one of the conditions that we see if we overtake vitamins. But vitamin C, vitamin E, these are vitamins which get excreted out of our body if they are in too much excess.
Okay.
At the same time, I will never advise you to take it for lifelong. You have to, that's why you have to see what condition, what vitamin you need at what time in life.
Okay.
But vitamin C, vitamin E are one of the safe vitamins which can be taken. Vitamin D, there is a regime that we follow. It depends on the deficiency that you have. It can be taken once in a week for 9 months, and then it can be shifted to once a month.
Okay.
But again, it depends on your dietary preferences also. So vegetarians should take vitamin D and should check it because they're usually low in vitamin D.
Yeah.
But you have to measure your levels and then take it. No, don't take it blindly for it.
Yes, yeah, because people do take blindly, so it's time for us as an audience and those viewers, we should take the vitamins, first visit the doctors, find out what vitamins are down, and then get the treatment for yourself with the help of the doctor. So, doctor, like we are talking about vitamins, so there is a word called also minerals. So, what minerals like iron, zinc, copper, do they promote hair growth, or whether like just vitamins? If I'm taking vitamins, it's okay. Minerals, we don't need to care about minerals. So, what exactly it is? Minerals are important for promoting the hair growth.
Of course, minerals like iron, zinc, copper are very important. Now, iron, what it does is it delivers the oxygen to your blood cell, the cells. So, iron is important for oxygen delivery, whereas zinc helps in tissue growth and repair. Copper aids in the melanin production. So, the melanin is the pigment that gives color to your hair. The black color that we see in our hair, in our skin, is melanin. So, copper helps in that. So, minerals also play a very important role in hair regrowth or hair structure, to be honest.
Okay, so for these minerals also we need to take supplements, or it's a diet is good enough to go for.
Diet is a good factor, but sometimes they're very low in our iron and zinc, and hence supplements are required for these conditions.
Okay, so for whether vitamins or minerals, we should get the supplements, and we should take the
We
supplements.
should get our levels checked. We should get our levels checked. We should make lifestyle changes so that we don't have to take these supplements forever.
Okay.
But it's like if there's no water in a well, you have to first fill up the basic resource and then you can make sure that okay, you will take out the water and it will be fine. If there is deficiency, then your diet will not help. Then you will need supplements. But once you reach an optimum level with the supplements, you can continue and maintain it with your diet.
Okay. Okay. Fine. Good example, doctor. Very good. So, doctor, moving on further, whether like these vitamins, nutrients, minerals, like, is it required to take nutrients as per gender RDA requirement, or you can just take it blindly?
So gender plays a very small role in the RDA, but your age and the requirement according to deficiencies, according to the disease requirement, plays a more important role in the RDA.
Mhm.
And hence, again, I'll emphasize which vitamins you're taking for which disease. Let your health professional decide that. Meet a hair care expert or a dermatologist and let them decide which are the RDA requirement what you are taking. Because some of the over-counter medications that supplements and you are taking have very small RDA. Then they're not meeting your RDA.
Okay.
So they might not be very optimum for your hair growth.
So
And that's why maybe it's not showing you the results that you are desiring.
Okay. So instead of taking blindly, we should meet to the doctor and get our like nutrients as per the requirement according to our body age and type, and then take it so that we can see the results.
Yeah.
So, like doctor, we have talked about lifestyle, vitamins, minerals, diet. So, does the stress also play a role in hair health? I mean, what's the impact of stress on hair health?
Stress is one of the most important factors for hair health because it can cause to hair health, it can cause hair loss, and hair loss leads to stress. So I always explain my patient that you are having stress, which is causing hair loss, and you're taking because again you have hair loss. So most of us, most of females also are so stressed out because of the hair fall that the cycle keeps continuing and we lead to telogen effluvium, alopecia because of the stress. And stress is not good for anything because it's not solving any problem. So few yoga, meditation is required to bring out the stress. You have to understand rather than taking stress, know why is the hair fall happening and treat it. It is as simple as that.
Okay, so like stress is like everyday in everyday life now we face stress. So is there any kind of a stage where we can identify, okay, now we should meet the doctor because of this the hair health is going down and it's time to visit the doctor.
So whenever you see that there is too much stress for your work or at home and you are seeing increased hair fall, that is the time where you decide कि okay, this is the time I should go meet the doctor, which will guide me, reinforce me on how to change my lifestyle, make some lifestyle modifications, and take care of the hair loss by suggesting you the right treatment.
Okay. Okay, so when you feel that stress is at the peak, you should visit the doctor instead of neglecting it and
Yes.
facing the problem. So, okay, so after stress, the another question comes to the mind, like when we are stressed at home, working day and night. So like nowadays, our mother also say oil laga lo, ya ye kar lo, wo kar lo. So like is like oiling at home, like oiling hair is a boon or a ban? Is it like should we do it or should we not do it at all?
So
Because some people.
I'm not somebody who's very pro for hair oiling.
Mhm.
Yes, it helps you relax a little. But the hot oil that we put in our hair damages the hair follicle.
Mhm.
Hair oil can also clog hair pores and which can lead to other diseases. The dripping of oil can clog your skin pores also and lead to acne. So
Okay.
hair oiling is not necessary now. I know age-old practice says that oiling was very good. Your mother will tell you oil से ही हमारे बाल बड़े हुए हैं. But it's a very superficial thing. Yes, it conditions your hair. So it helps reduce the frizz in the hair and all. But at what cost? So you have to weigh the risk and benefit and decide about the hair. Somebody who really loves hair, I would always suggest keep the hair oil for 1 or 2 hours. So apply it 1 to 2 hours before hair wash and then wash it. So that it has done the moisturizing effect and it is not causing you any harm by clogging.
Okay. So we can apply the oil 1 and 2 hours before the hair wash so that it gives a
Overnight oiling is something which should be avoided always.
Should be avoided. And doctor, some people like my mother also, we just put it on the scalp. So where should we put the oil, whether it is scalp or whether it is the hair shaft, what is the right technique for the oiling? Because oiling is something which everyone tries to do it.
So that's exactly what I told you. That hair oil is just causing the moisture. It's like a moisture breathing property that it is causing. It helps you lock the moisture. Okay. So if you apply whether on the shaft or on the scalp, it has a very superficial effect. It cannot lead to any hair regrowth or anything else.
Okay.
So whether scalp it will cause clogging. So shaft is still better, which is what is the desired result that you are. But any which way, I don't promote hair oiling in my practice at all.
Okay. 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 So, if you want to see the conditioning, you can apply once or twice in a week, but otherwise no to oiling for overnight.
Because we have much better products available, like leave-in conditioner, which does not cause clogging and all, and helps your texture much better.
Okay. Okay. Doctor, moving on to the next questions, Doctor, is it like this? Can you give us some important tips for healthy hair? Like, what do you think? All of us should follow the usual habits for a healthy hair.
Wow, Mona, you asked me a very interesting question.
Yeah.
Healthy hair has so many factors involved in it,
Mm.
from taking oral medications to our application. So taking good minerals, taking good vitamins, taking care of her internally, making sure of all the other diseases that can cause hair loss and treating those diseases, as well as topically taking care of your hair, which means choosing the right shampoo. So your shampoo should be gentle, choosing the right conditioner, so moisturizing conditioner, applying hair mask or leave-in conditioner once or twice in a week to help your hair nourish better and make it smooth. These are the common practices.
Okay.
Now, a few things which we shouldn't do is too much of hair styling, like too much of heat on your hair, like blow dry, curling, ironing, all of that should be avoided. When you're doing it, also keep it on a lower heat so that it doesn't harm your hair too much. Okay. Few other things like don't comb your hair when they are wet. Even if you want to comb, use a wide comb. Other things that can be done is rather than blow drying your hair or rubbing and trying to dry the hair with a towel, always let it air dry. Or take a towel, wrap it around your hair, and let the towel take in the moisture. Too much of friction will again lead to hair loss. And you will be like after the hair wash, I see a lot of hair because of this. Hair care practices like if you have dandruff, please treat it. Anti-dandruff shampoos are always, and again I'll emphasize, always used on the scalp and not on the entire hair. It will dry it out because of the chemicals that are there in anti-dandruff shampoos. So right hair care practices are very important. Okay. Then combing correctly, too much over combing is not good for us. So there used to be a saying that 100 brushes in a day will help your hair grow to better and nicer. It's all a myth. Too much of hair combing will cause too much friction and damage in it. Don't tie your hair too tightly. So ponytails and all, if they're too tight, it causes fractional alopecia. Wash it regularly. Regularly means 2 to 3 times in a week, not every day. because overwashing also leads to hair loss. So all these are basic hair care techniques where you can take care of hair at home regularly without any other thing, and your hair will always remain healthy and nice.
Okay, quite interesting tips, ma'am. Ma'am, when you were giving tips, I like the shampoo was really important. So when we have dandruff, there are so much of anti-dandruff shampoo in the market. So for when we have like some people have excess of like even I have seen many people in the work area also they have excessive dandruff. So for this they should visit to the doctor, or they just pick up and can use any kind of a shampoo and
So a regular dandruff, which is the mild dandruff that people have, you can pick up an anti-dandruff shampoo by yourself.
Okay.
Uh, I will help you with few names like Caraglow AD
Mhm.
shampoo or scalp or anything can help you quite a lot.
Okay.
These are really good preparations and they can be used at home. Use it once or twice in a week, not more.
Okay.
And don't overuse it. As well as if you're not getting any relief by that, then definitely meet a doctor and try and understand the cause for the and let your doctor decide which kind of shampoo is required for you, whether you need ketoconazole or any other product. So let your doctor decide the anti-dandruff shampoo. But Caraglow 80 is a very good anti-dandruff shampoo which you can try.
Okay. Okay. So washing your hair once or twice a week is good, or like alternative is good, or like how like is it like using shampoo is good for hair health, but how many times in a day or in a week?
2 to 3 times in a week is a good time to use hair shampoo, which comes to almost alternate, but not always alternate.
Okay.
Because if it's 7 days, so then two
Okay.
to three times is a good thing. If you are having too much sticky hair, you can go to 3 times. If you're having normal hair, then you can use twice in a week hair shampoo. Use a mild, gentle shampoo so that it's not too harsh on your hair and it does not remove all the moisture from the hair. So be careful about those things and use a sulfate and paraben free shampoo. So that will help prevent hair damage.
Okay. Okay. Quite
And always use a good conditioner after the hair wash. That is one of the most important.
okay. So conditioner is also important with the shampoo.
Yes.
Okay.
After every hair wash, you need a conditioner.
Mm. Okay. Okay. So nutrition, diet, shampoo, how many times you comb, how you dry your hair, what kind of a chemical treatment you're applying your hair, all decide the hair health. So viewers, please use the tips of the tips given by the doctor, so that you can have a healthy hair. I'm sure about myself, I'll try to follow the tips which you have given, ma'am. So doctor, this discussion was very informative, and I'm sure our viewers would be benefited by it. So doctor, can we take some questions from the live audience now?
Of course, I would love to.
Okay. So, Doctor, our first viewer is asking, okay, that's how many weeks can we go for our haircuts? I mean, hair cutting your
If you
hair.
see the split ends in your hair, do cut it because that causes damage to your hair.
Okay.
Otherwise, as and when you need a haircut, you want to change the hairstyle, have a haircut. It's not a problem.
Okay. Okay. So, if you see the hair splittings, then cut it.
Split ends
Otherwise,
and all, you should definitely cut your hair.
okay. Okay. And is it like haircut also like helps in growing the hair, of like because
That's a
because
that's
my
a
mother
myth.
keeps telling me that cut your hair so that your hair become longer. I say no, it it can't be possible.
Unfortunately, hair is a dead structure, so cutting it from here does not do any increase hair growth.
Okay. So do shampoos make our hair weak? Another audience is asking the question.
So
Does
that's exactly what I explained also, tried explaining at least, that shampoo does not make it weak, but over shampooing, over rubbing. So how you shampoo your hair also, if you are too harsh with your scalp, that can cause physical damage to the hair follicle and weaken it and cause hair fall. So be gentle when you are shampooing your hair. Use a gentle shampoo, don't use harsh chemicals in the shampoo. These are the important things. The contents of the shampoo is important, the method of which you are using is important, the frequency in which you're using the hair shampoo. That is.
Mhm. Like you gave us the tips, use at least twice or thrice in a week, and just apply on the scalp, not on the shaft for the shampoo. Okay. So,
No, 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 sorry. Shampoo you have to apply on the shaft because you want to remove the dirt.
okay,
But over shampooing is not needed.
okay, okay. So, so our viewers might be clear about it now. So we move to our next viewer question. Is it ever okay to use drugstore dye? I think he must be asking about dyeing the hair, coloring the hair. Um,
Coloring done by an expert is important because that leads to lesser hair damage. So home coloring and all can lead to more damage because we might not use it in a best way possible, the timing possible, and after all these procedures like hair coloring and all, your condition, hair condition. So moisturizing products are very. So I always say, okay, go to an expert, let them do what they do the best, and go to a right salon, let them pick out the good products for you, let them do it. That's a better way of going ahead with it rather than spoiling your own hair by coloring it yourself. You don't know exactly how much, what to do, not using the right way, not using the right product can damage your hair.
okay. Okay, so it's always better to visit the salon for a hair dye instead of picking it up by ourselves. Okay, so the next question by the viewer is: are dry scalp and dandruff the same thing?
Dry scalp and dandruff are not the same thing. Dry scalp can lead to dandruff, but they are two different entities altogether. A person can have less sebaceous activity going on in the scalp and lead to dry scalp. But when we call dandruff, it's because of increased sebaceous activity that we are seeing, the dandruff, and we see the flakiness that are there on the hair. So no, they are two different things.
Okay, okay. So dry scalp and dandruff is two different things. Okay, our viewer must be clear about it. Now we move to our next viewer question. What hair care routine can I follow to have a healthier hair? She must not have listened the tips carefully. So if you can let us know one more time.
So as we discussed in the healthy hair care tips, use a right shampoo, condition your hair well. Don't use too much of hair styling equipments. Use lower temperature while using the hair care equipments. Don't comb your hair too much. Use a wide tooth comb for after whenever you're combing your wet hair. And use good diet, nutrition to keep your hair healthy and active. And if you have any hair fall or any other serious condition, don't try and take care of yourself. Meet a specialist. Let them decide the right treatment for you. Even hair PRP regularly done can improve your hair quality, regrowth, everything. So all of this is recommended by your dermatologist. So meet your dermatologist if you are having any concerns about your hair or you want to keep it better or you want to increase the growth.
Okay. So interesting. Doctor, another question by the viewer is: what can I do to manage humidity induced freeze here?
So one important thing is to reduce that is leave-in conditioner and hair masks that are available. So leave-in conditions are available, which helps lock in the moisture and reduce the frizz in the hair. In right now in monsoon, we are going to see it quite a lot. So condition your hair well and use leave-in conditioner. So there are night creams that are available. You can put it on at night and wash in the morning. That helps lock in the moisture quite a lot.
Okay, so night creams are also there for the hairs.
Yes.
There is one interesting question by the viewer. Can you suggest the right hair care for curly hair? Curly hair.
So curly hair requires special attention because of the hair strands that are available. Again, I would emphasize choosing the right shampoo and conditioner is very important. And hair nutrition is very important in a curly hair because they lack a lot of nutrition, because of which the keratin bonding is different. So taking few hair supplements will help you a long way.
Okay. Quite interesting. Doctor, okay, this viewer is asking, as you said, we should use sulfate-free shampoo. So I am using sulfate and paraben-free shampoo. Can I wash my hair daily? Like he wants to wear.
Daily washing is not recommended. Is there any specific reason why you want to wash it daily? Few conditions why we want to wash it daily is if you're too much working out and our hair is very oily, it leads to a very oily scalp and we don't like it. So I would say wash it alternate days, and the all other alternate days just rinse it with water. Don't use shampoo.
Okay. And the same viewer is asking another question. Then what does deep conditioning means?
What does?
Deep conditioning means if I can't wash my hair daily, then what does deep conditioning mean?
Deep conditioning means shampooing your hair, conditioning your hair after the shampoo.
Okay.
So there are good deep conditioners available. I will not be able to take the brand names for it, that's why. But otherwise, there are very good deep conditions available which you can use. And there are nice leave-in conditions that are available, where after washing and conditioning your hair, you can put it on your scalp if you have very dry hair.
Okay. Okay. So
But everyday shampooing is not recommended.
he
Please
must
get
be
that.
thinking that everyday shampoo will provide nutrition to his hair.
Shampoo is not providing any nutrition to your hair. It is only helping remove the dirt and chemicals from your hair.
So shampoo will help you to clean the dirt, and twice or thrice in a day washing is good. If you have some occupational problems, then you can visit the doctor and get the right advice how many times you should wash. Okay, so doctor, another viewer is asking that he has alopecia. So does he need to take vitamins, and which vitamins are good for his hair?
Alopecia is a very broad terminology. Again, alopecia means nothing but hair loss. Now, what is the cause of hair loss that he or she is having? Alopecia areata is something where a specific patch of hair loss is seen in the body. Androgenic alopecia is hormone dependent. Then hair loss due to post any infection is called telogen effluvium. So, what is the cause of the hair loss? We need to know. If he or she has alopecia patch, then the patient will need some specific treatment like taking intralesional steroids on that or some oral medication that will help. If the patient has telogen effluvium, we suggest some good vitamins and minerals for that patient. Biotin can help the patient quite a lot. So depends on what type of alopecia the patient has, I'll be able to suggest what treatment is required.
So we're shorting off our time. So I'll just take the last question of our viewers. Is it possible to stop my hair from graying?
Is it possible to stop your hair from graying? Very important, very interesting question. Okay. And we are still trying out different methods and procedures and treatments for the same. The hair which is already grayed out. So a lot of us nowadays, many young people are also seeing graying of hair at an early age. The gray hair which has been grayed out cannot be turned black again. Let's be very clear about that. But you can prevent the other black hair from becoming gray. So IPCA also has one very good tablet which is available to stop graying of hair. Even they have come up with a serum. So we can try it out for sure to prevent more graying of hair. But the hair which is already turned gray, there are very less chances. And right now we don't have the technology to convert that hair again into black. So if you are having that, take an intervention quite early if you are younger and if it bothers you, so that you don't have entire gray hair anymore.
Okay. So if someone is facing a gray hair problem at a younger age, they can take tablets like from IPCA and other with the help of the doctor and uh, to stop the graying of the hair. But already grayed hair cannot be turned off to black again. Okay. Okay, ma'am. Doctor, would you like to give a take-home messages and suggestion to our viewers today?
So today the take home messages, as we discussed again and again, and try and find out the cause. Don't hesitate to do blood investigations. Multivitamins, nutraceuticals are very good for your hair. Choosing the right treatment modality can give you very good results for your hair growth. Hair loss is a problem that we all face, we are all going to face because androgen megalopation is very common. Right modality at the right time, like PRP, GFC, hair transplant, can be decided according to what is the need of the patient and the medical conditions associated with it. So, whenever you are having a hair loss, take due steps. Don't stress about it, rather act on it, and we will see very good results.
Okay, so viewers, please, fo- ma'am, if you can repeat, I want
If
to,
you're having hair fall, viewers, please listen to me and meet me.
yes, yes.
So if you are having hair fall, you can always come approach a dermatologist, me or anybody else, to be honest. But yes, take due precautions and take them.
Yes, and be stress-free and take act on it. Yes. Okay.
Yes.
Thank you
Let's
so.
stress more of action.
Yes, yes, more of action. Yes. Thank you so much, doctor, for sharing your expert advice on various issues causing hair problems. I'm sure people will benefit from your advice and will be better prepared and equipped with the managing hair problems. Thank you, doctor. It was a delight to have you, and thank you for your valuable time.
Thank
Thank
you,
you.
Mona, for being an amazing host and helping us get through this hair journey. And thank you, Ipka, for a great initiative in educating people and not just having Instagram knowledge, educating people in the right way for hair loss problems so that we stress less and act more. Thank
Yes.
you, Ipka. Thank you, Mona, for this great initiative.
Thank you so much, ma'am. Thank you for your valuable time. Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your